Hello, everyone. Welcome. Today, I wanted to talk about ashwagandha and its numerous roles. Ashwagandha, scientifically known as Withania somnifera, is an adaptogenic herb that has been used in traditional Ayurvedic medicine for centuries. It is believed to offer a wide range of health benefits, and some of those are like stress reduction and anxiety relief. Ashwagandha is well known, popularly used for its adaptogenic properties, meaning it helps the body to adapt to stress. It has been used to reduce stress, anxiety, lower cortisol levels in the body often. It also improves cognitive function. There are studies to suggest that ashwagandha may help improve memory, cognitive function, and attention span. It is believed to have neuroprotective effects or properties, potentially protecting against neurodegenerative diseases like Alzheimer's. It enhances energy and stamina. Ashwagandha is often used to increase energy levels, stamina, making it beneficial for individuals who are experiencing fatigue or weakness. It is also used to support immune system. This herb is believed to have immune boosting properties, for helping to fight infection and illnesses. Uh, it can also reduce inflammation. So, ashwagandha has anti-inflammatory effects, which may help alleviate symptoms of inflammation or inflammatory conditions like arthritis. It's often used for insomnia, very popularly, improving sleep quality. Some research is there which suggests that ashwagandha may help improve sleep quality, regulate sleep patterns, and make it beneficial for people suffering with insomnia or sleep disturbances. It is also known to balance hormones. So, ashwagandha is believed to have that hormone balancing effect, particularly in women. It may help to reduce the cortisol levels, reproductive hormones. It also improves muscle strength and recovery for athletes and fitness enthusiasts. They often want to use or they use ashwagandha to improve muscle strength, endurance, and recovery after exercise. Blood sugar regulation. Some studies suggest that ashwagandha may help lower blood sugar levels and improve insulin sensitivity, making it potentially beneficial for individuals with diabetes or even a pre-diabetic. It has properties is often used as aphrodisiac and improving sexual health in both men and women. It's important to know that while ashwagandha has been used for centuries in traditional medicine like Ayurveda and also has shown promising results in some studies, more research is needed for to look at its efficacy or understand its efficacy and safety also for all these various health conditions. And individual responses to ashwagandha vary, so that's also very important factor to remember, that everybody is not going to react to ashwagandha in the same manner. So that is something that one has to remember. Also, remember to take it after consulting an healthcare professional before starting any new supplement or herbal remedy, especially if you have any underlying health conditions or even if you're taking other medications. So the therapeutic dosage of ashwagandha can vary depending on factors such as age, weight, your overall health, and specific health conditions which is being treated. Additionally, different forms of ashwagandha are present, like powders, capsules, tinctures. They all may have different recommended dosages. So some general guidelines are available, and those are usually what people go off by, but still can vary based on a person. So the typical dose of ashwagandha ranges from say 1 to 6 grams per day, divided into 2 or 3 doses for most people. It's often mixed with water, juice, or added to smoothies. Ashwagandha capsules, if you're taking, or tablets, the recommended dosage of ashwagandha is about 300 milligram to 600 milligram of the extract, taken in divided doses. And instructions are usually given on the product or also your healthcare professional or your practitioner will tell you your personalized dosage recommendations. So follow those. Ashwagandha tinctures are usually very concentrated extracts of ashwagandha, and then the recommended dose of ashwagandha tinctures vary depending on the concentration of the extract. So it's very important to follow the dosage instructions provided on the product label or consult your healthcare professional for guidance. If you're taking standardized extracts, some supplements can contain those. So make sure that the level is consistent with what the active compound is in there. And dosages of these standardized extracts can vary. So it's important to follow the manufacturer's recommendation or consult with a healthcare professional. And therapeutic doses of ashwagandha could be higher for certain conditions or for certain individuals or with specific needs. So again, always consult your healthcare professional or a doctor or a naturopath, a physician before you start ashwagandha supplementation, especially if there are any health conditions, if you're pregnant or breastfeeding or taking any other medications. It's always also a good idea to start with a lower dose of ashwagandha and gradually increase it over time as needed, while still monitoring or looking for any kind of side effects. Some individuals can also may experience stomach upsets, drowsiness, particularly when they're starting on ashwagandha. And if you happen to be the one who's experiencing any such adverse reactions, please discontinue and consult a healthcare professional again. While ashwagandha is generally considered safe for most people and is available everywhere, but in taken in appropriate doses, some individuals can still experience side effects, especially when taking high dose or using it for a long period. So common side effects, like I already said, can be GI, gastrointestinal upsets. Some people may have mild, while other people may have a lot, an extensive stomach upset with diarrhea and nausea. Some people may feel sedation and drowsiness because ashwagandha is mildly sedative and may cause drowsiness in some individuals, particularly when taken in higher doses or even before bedtime. Some people may have headaches, rarely though, but some people may experience headaches or migraines also. Some people may have allergic reactions, again, very rare, but it's seen in very sensitive individuals. So symptom of an allergic reaction could be like you're having an itch, a rash, a swelling, or even difficulty breathing. Blood sugar levels will change. So ashwagandha may lower your blood sugar levels. So individuals with diabetes or hypoglycemia should monitor their blood sugar levels closely while taking ashwagandha, as it can interact with their diabetic medications as well. People also see blood pressure changes. So ashwagandha may have a lower your blood pressure. So if you have low blood pressure or you're taking medications to lower your blood pressure, always consult with a healthcare professional before you take any ashwagandha or use. Thyroid. So some studies have suggested that ashwagandha may affect thyroid function, particularly in individuals with thyroid disorders. So if you have a thyroid condition or are taking any thyroid medications, speak with your healthcare provider before using ashwagandha. Pregnancy, breastfeeding. So while ashwagandha is generally safe for most adults, pregnant and breastfeeding women should not use it, should avoid, as its safety during pregnancy and lactation is not been well studied. So interactions with medications, ashwagandha may interact with certain medications, including sedatives, thyroid, diabetic medications, and also immunosuppressants. If you're taking any of those, again, consult your healthcare professional, your Ayurveda practitioner, or a naturopath before taking ashwagandha to avoid potential interactions. It is essential to use these supplements very responsibly, follow the recommended dosages, and if you have any adverse reactions while taking ashwagandha, discontinue. Always consult with a healthcare professional or your Ayurvedic practitioner or again your naturopath before taking ashwagandha. And again, the responses can vary from person to person. So just be careful. Next time, I'm going to address use of ashwagandha for muscle building. So stay tuned. Thank you.